Sleep apnea is very important. It has major consequences, major comorbidities associated with it. So people should be careful about their snoring. It can definitely result in high blood pressure. It can cause weight gain. It can cause work-related accidents, roadside accident, daytime sleepiness, mood disorders, you name it, and it is associated with sleep apnea. So that is something snoring is a main symptoms and people should pay attention to it.
So why is it that no matter the length of time someone sleeps consistently, that they never feel restored? What could be some of the reasons for that?
So the very main reason for somebody not having restorative sleep is if they have sleep apnea. Because one thing is sleep quantity and one thing is sleep quality. If somebody is getting good quantity sleep but their quality of sleep is poor, they may not feel fresh. Even sometimes they feel more fatigue after waking up.
So that's one of the symptoms of sleep apnea. What are some others people could be on the lookout for?
Snoring for the first thing to look at. Second is waking up during sleep. So these people are unable to sleep throughout the night and they wake up several times. And most of the times once they wake up, they feel like, okay, maybe I have to use the restroom. And they say that I'm waking up to use the restroom. So there can be some other reason for waking up to use the restroom, but snoring and sleep apnea can be one very important reason for that. Other is gasping for air. Sometimes people wake up gasping, choking, coughing. Their spouse can tell them that, hey, you stop breathing. So there are pauses in breathing. So all these symptoms are there to look for.
Got it. Is there a best way to lay when you're sleeping for sleep apnea?
So for sleep apnea, actually sleeping on the side is better, because once you sleep on your back, actually your sleep apnea can get worse. Sleep apnea is worse in the supine position. For normal people, sleeping on the back is good. For people who have sleep apnea, it can worsen their sleep apnea.
A lot of folks had questions about treatments and devices. So this is a pretty targeted one. But do you have any opinion of newer, less expensive, and less invasive EPAP devices versus the traditional CPAP, BiPAP therapy for treatment of sleep apnea?
CPAP and BiPAP therapy comes in many different forms. We also have a device called APAP. So it's an automatic PAP device. This device is more advanced. It monitors the breathing throughout the night and it delivers the pressure you need. So you don't have to get the study to find the CPAP or BiPAP pressure. Like your doctor can just prescribe you an APAP. If you're looking for a smaller device, there are smaller devices in market, like travel CPAP, travel APAP. So these devices are smaller, easy to carry, and easier to use. As far as other devices available in the market which claim that they can treat sleep apnea very well, most of them are not very well researched and very well studied on patients.
Got it. Do alternatives to CPAP like surgery work and stay working?
So that's a very good question. A lot of people think that if they get surgery, which is an oral surgery in which they create some space back in the throat, can eliminate their sleep apnea, but that is actually not true. The research over many years has shown that it can only help 30 to 50% patients, and the sleep apnea can come back afterwards, because sleep apnea is basically from obesity. The upper airway plays a role in it, but the obesity plays a major role in it, and the surgery doesn't treat obesity. So the oral surgery doesn't treat obesity, I should say. So the oral surgery can help in a certain population, but for most of the people it may not work and is an invasive procedure as compared to CPAP or BiPAP.